corner lip lift, which means the sides of the mouth are pointing downwards and it looks like a frown. So we do a little tiny procedure on the end, we hide the incisions, and we get the lip to that frown. So you can see here the incision is following down above the vermilion border. That way we're not getting rid of the natural crease on the lip itself. And we follow into the crease. And you make sure not to touch the muscle because you want the muscle to function perfectly over here. So this is all it takes for a corner lip lift. You have to make sure not to do it excessively or they will look like a joker afterwards. Getting the skin out, not touching the muscle, just the skin itself. Nice and careful not to damage the muscle. With just a tiny bit of local anesthesia, we don't have much in there. Are you feeling anything?
No, I'm not.
And it's always good to ask a patient a question when you have release the skin above the area and the skin below to get rid of tension so you don't get any scarring. So over here we've released below the commissure a little bit to help release that part. And we're going to now start reapproximating from lateral to medial under the commissure here, and then we're going to let that lift up a little bit. We're going to close from lateral to medial, medial to lateral, so we don't have any dog ears on the end here. We don't want an extension. So right now we've closed the lateral portions and we're moving to the medial portion. We're putting deep stitches, which is something people don't do in this area for some reason. These deep stitches really help prevent the scarring. So right now we're putting in vertical mattress stitches. These help evert the skin edge, and this is really what prevents the scarring from these. They tend to remain a little red for a while. So you can see here we're placing vertical mattress stitches all the way along to give eversion. The reason we're doing this procedure is because fat was injected here in the corners and it causes irregularities. It causes irregularities, which is why it should not really be injected superficially in areas like this. So typically you'd want the incision to come around here and up in this direction because you want to give it the appearance of a lift, but every patient is different. Every patient has a different area that needs to be removed. There's a different area which needs to be removed, so you can't really adhere to that. You have to design it depending on the person's own anatomy. She had irregularities from fat injection, so we had to come around. You can see the skin being lifted off this lower muscle layer. There's some filler in there, which is what gives it that glare. So we're going to do that without damaging any of the muscle. This is absolutely symmetric, which is why their incision design should not be symmetric. So now we're elevating the vermilion up slightly. Very slightly, you don't want it to roll. Closure again from the lateral part to the medial part, we're using a 5/0 PDS absorbable suture. Stitches along the border to evert the skin and prevent scarring that you normally see with these. Now we're continuing medially with these vertical mattress stitches using a 6/0 nylon. Small stitch, eversion. Finishing up here, just getting the closure done. It's all everted, which is what you want. Not having any pain.
And this is one happy patient.
So we're crying here a little bit, but we're not showing your face.
I love you. People are probably going to think I'm doing something.